Are you feeling tired, bloated, or even anxious or inflamed? The real cause of your health issue may not be what you think. Welcome. If you're new to my channel, my name is Dr. Erica Steele. I'm a board certified naturopathic doctor. I hold 7 degrees in my field. They're all in the natural healthcare space. I like to say that I went to school so you don't have to. If you want to continue your learning, past this video, we do a short video, but then we have lots of content, both in a simple webinar, 1 hour, 30-minute webinar, or even our wellness collective that organizes everything, puts several webinars in place, several videos, downloadables, all kinds of resources to help you be more proactive with your health. Definitely click the link below. If you are looking to be educated on a holistic lifestyle, welcome to a fire hose of information. I'm here to teach you all about your health. Okay, so let's jump in. Let's talk about root causes. So root causes are not often the symptoms. So a lot of times when people talk about their root causes, they're talking about, let's say, fibroids, or they're talking about diabetes, or they're talking about inflammation. And while those things are definitely, symptoms to be aware of, they are not root causes. So when we're talking about root causes, we're talking about nutrient deficiencies, accumulated toxins, overall organ health and function, and areas of prevention. So we have to go through literally therapeutic order where we have to stabilize the foundations of health, support the weakened organs, and then get those detox pathways working. So it is a process. It's not a one-size-fit-all approach. It's definitely not a pill for every ill. I know in the alternative medicine world, there's a thought process of, I'm just going to look up this particular medication and then find an herb or a pill that will replace it. That actually isn't how we treat in holistic medicine. So that's how they treat in conventional medicine. So conventional medicine often manages the symptom. So they're going to look at those symptoms as the result and treat those. Whereas in holistic medicine, we really take a step back and we assess the foundations of the person's health, where they are with their sleep, their nutrition, their movement, their water, anything that have to do with their foundational health we look at. Then we'll look at the health of their organs. Are they overly toxic? Do they have mold exposure, chemical exposure, heavy metal exposure, etc.? Organs weak? Do they have an infection? Are they in long COVID? Do they have a GI issue? Are they inflamed? Are their joints bothering them? Where are the organ systems that are most threatened? And then we look at disease process. Has this patient manifested their disease to the point of now a diagnosis? So instead, conventional medicine ignores most of that, and they wait until you have a disease, or when you come in, you say, I have this symptom, I have that symptom, I have this symptom, and then they pull out this pill and that pill and that pill. So that thinking, oftentimes people come over into holistic medicine thinking that that's the way we treat, when in fact we don't. And a lot of charlatans in the field, unfortunately, will capitalize on ignorance. And what they will do is now become supplement salespeople. And so now it's, you go on lives or you go on different things and you're like, what do I do for this? And without even taking any health history, they're like, here, take this, take that, take this, take that. And that really only manages the symptoms. So this is why we use testing. So we don't guess, we test. And in functional and integrative medicine, we utilize testing. Now, testing doesn't have to be invasive. We don't have to always do blood or serum or urine or hair. Sometimes we can just do simple pH tests at home. And in our intro to holistic medicine course, we actually walk you through, those simple at-home tests that you can do to really determine where you are with your state of health. Remember, health is a state that we create. It's not a disease that we manage. We want to be proactive instead of reactive with our health. And so if we're proactive, we're going to be monitoring, we're going to be connected, we're going to be checking our body, and we're going to be listening to our body for clues on what needs to be foundationally addressed, whether it's our sleep, our food, our water, etc. If it is an organ system that needs to be supported, let's say either the lungs, like I just coming over a cold, so my lungs really need to get supported, or is there detoxification? Is my liver needing cleaning out? Is my large intestines? What's actually going on underneath the surface that I can figure out if I use appropriate testing. So if you want to learn more about how you can heal yourself and your family holistically, definitely check in all of the links below. We have tons of goodies just for you.